private. We've noticed a number of people in our system, I call it the dysfunctional family risk factor, where when people do get divorced, they're not always nice to each other, and there are many times where people try to get information about another family member online for all kinds of nefarious purposes. They want to control custody of the child, they want to look at information and throw it back at somebody. So there's actually that risk, which we don't talk about too much openly. We think it's all technical risk, but I think in many cases what you're seeing now as the systems become more secure as systems, and you can track and find out who went where, you can never completely eliminate the human factor in terms of how people manage systems. Going ahead, we were having a nice conversation before we came into the room about the multitude of vendors that are entering this space. It isn't just a few big companies that are going to devote a lot of energy and attention to security and privacy. You're going to have dozens and dozens of companies trying to integrate with each other and pass data, and I think that actually presents quite a risk for consumers going forward, because it's unclear how all those data connections will be managed and overseen. So that's a little bit about the perspective that we have and the experience that we've had over about 10 years with offering online health services to a very large population.
Good morning. My name is David Cerino. I head up the Microsoft Health Vault effort back in Redmond. I view this maybe a little bit differently than others. When I read the title, when it says who you trust with your health data, I don't think of a single entity, because I think that the way this is going to have to work is everybody's going to have to become part of kind of a bigger trusted health network. So it doesn't matter if I do my part, if Annalisa doesn't do her part and Chuck doesn't do his part and so on, and it starts to break down somewhere. This is going to be a little bit like a chain effect, that it's only going to be as strong as, you know, the weakest link in here. And I think that's one of the key points is that the way that consumers will view this is that security, privacy, trust, however you want to label it, it becomes basically the price for entry. Once you have people enter from a consumer perspective, you really pretty much buy it. So the idea is that you got to cross that kind of initial chasm, if you will, that says what's going to make people start to adopt different principles and different ideas. So my background comes from a lot of online banking and a lot of online travel. So I did online banking in the kind of early to mid 90s. And when everybody was saying there's absolutely no way I will trust this whatsoever, you don't really have the trust and privacy and security issue in your head too much anymore. And I still don't have it, and I was telling my peers on the panel earlier, I've received 6 letters from various banks and mortgage companies over the last month that my data has been compromised. So the numbers that John's bringing up are relatively small to the big picture, but we're going to have to look at this going forward, that on the number of incidents is going to go up. We also talked earlier about that don't ever go out to the FAA website, because they have to log every single incident of air travel. You will never fly again if you go out and you look at the number of incidents that are going on. It would really break your heart to see what's going on out there. So I would just say that I think this is an initial thing. I think that once we kind of prove it out at the beginning and you start seeing adoption, and I think that there's some core principles that you have to think about when you think about trust overall. First of all is transparency, that if somebody knows exactly that their data is going to be moved, that they have kind of the second factor, which to me is control. So transparency is they know kind of how their data is being used. Control is they're saying, yes, it's okay if I do that. And I think the third point is that they're comfortable with the pipe between those two things, which is how data is actually going to move. Because if you really actually mapped out an ACH transaction every time that you do an online check and you watch that flow through the networks, you'd be shocked about how your data is moving around and how many points of potential failure that there actually are. So I don't think we should make it about can Microsoft do it, or who can do it the best. It has nothing to do with that. It's going to have to be the common link between all of us.
Okay, thanks for those interesting statements. I guess I'll circle right back to you then, David. And my question is, so what do you think it will take to get citizens as comfortable with the online storage of their personal health information, PHI, and the management thereof, as they are now today, comfortable with doing their online banking, going and doing their online shopping, what have you. And what is it going to take? Because right now it seems there's a lot of noise being created in the marketplace around privacy and personal health information by a number of different organizations. So what do we need to do to kind of get the average consumer comfortable with this model?
I think it's twofold. I think one's a behavioral one, which is, believe it or not, when they hear it from the least technical person in the healthcare system, which is going to be their physician. As soon as their physician says, this is what I want you to do, I'm going to start interacting with you on a more digital basis, I think the trust factor will shoot extremely high, which is kind of strange when you think about the fact that it's really not the physician who's going to strengthen anything technically around trust or security in that entire chain. And I think the second one is they're going to be more the people that really believe that there's some value earlier in the process. So all the research that we've done at Microsoft shows that the value is going to be around what we call the family health manager, being able to manage either their children, aging parents, their pets, believe it or not, and unfortunately spouse. That's the priority order. Unfortunately, it's true.
Dog first, huh?
No. Children come first, aging parents, then pets.
Dog before spouse.
So yours truly is running dead last in the priority equation of health management. And that's because the family health manager really believes that they're the protector of the family. So if they start seeing value in the fact that they can, by using a Bluetooth glucometer that Johnny with juvenile diabetes goes to school every day, and going back to the last panel, being able to see Johnny's readings on the mobile phone to make her feel better, that is extreme value. And if anybody's dealing with an aging parent right now, I live 3,500 miles away from my father, and when everybody up here said consumers won't pay $350 for the MedApps device, whatever, I would if I knew that my dad was doing something in particular and I could see those. So I think a lot of times if you just think about it from a personal standpoint, if it adds value, number one, and I think the second thing is this strange thing about we'll do anything that a doctor tells us to do. And my dad's a doctor, and I unfortunately haven't done that my whole life, but that's a different story altogether. That's another panel. But I think that's the other interesting part is what will actually change the behavioral aspect as well.
Okay, now, Colin, yes. Dossia is kind of an interesting model in that it's being supported by and large by employers. And there's always been, at least out there in the literature, a lot of questions on the parts of employees trusting their employers with having any access to their personal health information or being involved in any sort of fashion with a PHR that an employer is sponsoring or even an insurer is sponsoring. Now, in Dossia's case, you're working for employers, and a lot of the data that you're bringing in is coming in from insurers, from the payers. So how are you, as an organization, addressing the privacy and security of the personal health information so that employees feel comfortable in actually using this?
It's interesting. The Markle Foundation did a study on who would you trust with your data, and the two groups that came in dead last was the insurer and the employer on that list. So, but I think a lot of these issues, both the consumer perception in both those cases is there's a lot of urban myth and legend in this. I mean, people say, well, look, I don't want my insurance company to have my data because I don't want them to know I'm sick, or otherwise they wouldn't insure me. Well, they're going to find out sooner or later if you actually make a claim, and then you're screwed because you've lied to them. So I think there's a lot of this sort of myth and legend that goes around this. The majority of, the employees that we've surveyed, know where they get their health care from. They know, we're working for a lot of large self-insured employers, and I think people understand where their data comes from, understand where their health services come from, who's paying for it. They certainly don't want their employer to be specifically involved in the information that they provide. So we've gone to a great deal of trouble to make sure that Dossia is built and is marketed to employees very clearly as something that's independent.